This week, Minnesota struggles with CMS continue, but relief may be in sight, and Americans are more worried than ever about health care. Welcome to the April 3rd edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mochtig.
The effort to give a lifeline to Hennepin Healthcare stepped up this week as workers at HCMC went to the Capitol to make an in-person plea for a change in tax law to help shore up the hospital's finances. Paramedic Shane Hollow said many people don't appreciate how broad the impact of a breakdown at HCMC might be.
If HCMC closes, our patients don't just disappear, the emergencies don't stop. What happens instead is the entire system will strain under the weight. Emergency departments across the Twin Cities will take on more than they're built for. Ambulances will spend more time waiting to transfer care. Response times will increase because paramedics are tied up longer. And for patients, that means delays in care at the exact moment when minutes matter most.
Administrators have said they need to cut about $200 million this year and say they haven't yet met their first quarter's $50 million goal. A measure to direct a 1% county sales tax to Hennepin Healthcare is expected to be introduced in the legislature next week. And an additional development, one of the hospital's two interim administrators, Dr. Kevin Croston, formerly the CEO at North Memorial, announced he was leaving this week after 3 months on the job. Also this week, a widespread interruption of Medicare reimbursements dating to January continued, as some providers said a freeze of federal payments was threatening their financial stability. Abby Mochtig has more.
Hospital officials said despite indications that a glitch in Medicare payments had been resolved, money still wasn't flowing to many small hospitals. The problem stemmed from an effort last year to fight fraud by blocking potential double payments. But the change inadvertently kicked many rural providers out of the CMS payment system and rejected their standard claims for reimbursement. Mille Lacs Health System CEO Andy Knudsen told Fox 9 that the financial situation for the hospital in Onamia was growing dire.
The savings are getting lower and lower as we go on, to the point where now we're starting to look for banks and lines of credit to help us get through this point.
The Riverwood Hospital in Aiken, as well as others around the region, were reporting similar issues. Minnesota providers said it was compounding unpaid reimbursements stemming from the collapse of UCare, the state's second largest Medicaid Advantage insurer after Blue Cross Blue Shield. And the state's Department of Human Services said it expects to meet new standards from the Centers for Medicare and Medicaid Services and to unfreeze hundreds of millions of dollars in payments to the state. But State Medicaid Director John Connolly also again urged the legislature to take up Governor Tim Walz's proposal to overhaul the administration of medical assistance, Minnesota's version of Medicaid.
So here are the ideas we think legislators should focus on. We need to consider moving from the use of managed care organizations to consolidating those services under a single administrative service organization. 45% of Medicaid spending in Minnesota and 80% of our enrollees are now being handled by multiple organizations or MCOs. A single entity to do that work will allow everyone to have the same provider network, rules, policies, processes, which eliminates complexity and access barriers.
Connolly also said the state should take over eligibility determinations and proposed a 3-year study of how to better handle Medicaid waivers, a key administrative function for accommodating beneficiary and program changes. Also this week, a group of 600 doctors and primary care providers said they have reached a first tentative contract with Allina Health. Allina said the deal, quote, supports Allina Health's ability to continue caring for our community well into the future. Members of the union, calling itself the largest union of private practice doctors in the U.S., are expected to vote on the deal next week. In Washington, the Trump administration on Thursday announced new tariffs of up to 100% on imported brand-name prescription drugs. Abby Mochtig has more.
The move is part of a broader effort to lower drug prices and bring more pharmaceutical manufacturing back to the U.S. Companies can avoid the tariffs if they build U.S.-based manufacturing facilities and reduce drug prices. They can also qualify for reduced rates if they commit to shifting production domestically. The tariffs are expected to increase drug costs for hospitals and patients, disrupt global supply chains, and potentially contribute to medication shortages.
And finally this week, Gallup released a new poll gauging public sentiment in the U.S. with some surprising results. Healthcare now tops the list of concerns among Americans, Gallup said. Healthcare and affordability top the economy among public concerns, with about 61% of survey respondents saying it concerned them a great deal. That's 10% more than those whose top concern was the economy. In fact, economic worries have declined nearly 10% in the last year, as healthcare has risen about 2%. That rise is mostly among Democrats, Gallup said. 4 out of 5 cited healthcare as their top concern. Gallup said 2 out of 3 independents responded similarly, and illegal immigration remains the top concern among Republicans. Gallup said the findings from March likely don't fully account for changes stemming from the U.S. attacks on Iran or Iran's restrictions on the global oil trade. That's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig. Thanks for listening.